Scientists are producing more genomes to determine if the new coronavirus variant is spreading. The National Health Department has been alerted and is in discussions with the scientists who discovered the XBB 1.5 variant. The Omicron subvariant has been dubbed the most transmissible in the pandemic so far. Our senior reporter Silindelo Masikane tells us more.
Last week, researchers and scientists at the Stellenbosch University identified what's been dubbed as the most transmissible subvariant in the pandemic so far through a process called genome sequencing. This process has been done every week since the start of the pandemic back in March 2020. Samples are received from diagnostic labs which undergo genotyping to identify mutations and the types of variants circulating. In all 9 provinces, labs have received yet another batch of samples for testing.
South Africa has one of the most advanced genomics program in the world, and if we detect viruses, variants or different pathogens early, we can prepare to respond. And I think that was one of the reasons why the rest of the world in the last year had a lot of deaths and had restrictions, and South Africa had not, because we can identify very early, we can communicate very early, and if the need arises, we can make sure that our hospitals are prepared to that, which again, I do not believe that we have any reason to be nervous or to be panic. I think that South Africa is very unlikely to have another big wave of infection.
But just how far are we from declaring an end to the pandemic?
We're moving to a phase that the virus continues to circulate but do not cause havoc in the country. I believe that's the phase that we are, and I believe that we're going to continue in that phase. And that's why this kind of work is so important, because we want to make sure that we know what is circulating.
Meanwhile, the Western Cape Health Department is keeping a close eye on the subvariant.
The Western Cape Department of Health and Wellness will be monitoring the emergence of the new variant XBB 1.5 very closely. Thus far, we have not detected any increase in cases, hospitalizations or deaths.
While genome testing continues, South Africans are being urged to vaccinate or get their booster shots. The Minister of Health is expected to meet with the National Coronavirus Command Council and update the nation. Silindelo Masikane, Cape Town.